Hello everyone, this is Dr. Judy Shaw with Shaw Medical Travel Consultants, and today we are continuing our conversation on healthcare disparities, and we have the privilege of speaking with Walter McNeil Jr. Hi Walter.
Hello, how you doing?
I'm doing fine, thank you. And he's going to give us a little information about his experiences within the healthcare arena. Now, Walter is, let me get this right, Walter is in management within the automobile industry, and he's been doing that for many years, originally and currently from the Texas area. And so he has some experience either personally or from a family standpoint with dealing with the healthcare environment in one method or another. Mr. McNeil, I am going to go ahead and just give a little bit of blurb about some facts about African-American experience within the healthcare arena just for a few minutes. Now, according to morbidity and mortality reports, the African-American, Black American, and African-American experience within the United States. In the 2000 census, Black Americans constitute about 12.9% of the US population. Black Americans and non-Hispanic Blacks bear a disproportionate burden of disease, injury, death, and disability within this country. The top 3 causes and 7 out of 10 leading causes of death are the same for non-Hispanic Blacks and non-Hispanic whites. But the risk factors, incidence, morbidity, and mortality rates for their diseases and injuries are greater among Blacks than whites. 3 out of 10 leading causes of death for non-Hispanic Blacks are not among the leading causes of death for non-Hispanic whites. Homicide is 6, HIV 7th, and septicemia, which is infection all over the body, is 9. Eliminating these disparities will require cultural appropriate public health initiatives, community support, equitable access to quality health care. For example, in 2002, non-Hispanic Blacks had more years of potential life lost than non-Hispanic whites for homicide, which was 9 times higher, strokes 3 times higher, perinatal disease, that's diseases around the time of birth and delivery, 3 times as high, and diabetes 3 times as high. That is in non-Hispanic Blacks versus non-Hispanic whites. A couple other facts to bring home the gravity of this situation here. Non-Hispanic Blacks trailed non-Hispanic whites in at least 4 positive health indicators in 2002. Number 1, persons who are less than 65 years old with health insurance, 81% versus 87%. Adults greater than 65 years old vaccinated against influenza, 50% versus 69%. And pneumococcal disease, that's pneumonia, 37% versus 60%. Women receiving perinatal care in the first trimester, that's the first 3 months, 75% versus 89%. And 4 persons greater than 18 years old who participate in regular moderate physical activity, 25% versus 35%. So there's lots of things that can affect this, and we're going to talk about that today. Socioeconomic factors, lifestyle behaviors, social environment, and access to preventive health care, such as cancer screening and vaccination. This is particularly important now that we're talking about coronavirus and the vaccination that is currently available, and the resistance in the Black American, particularly population, to get this vaccination. So with that said, we'll go ahead and get started. So tell me a little bit about yourself and just a little bit about your experiences, generally here in the Texas region, or if you've had experiences elsewhere as well, but just a little blurb about you and your experiences, if you could.
Okay, well, I've for the most part, have been in Houston the majority of my life. I have lived abroad, um, Mexico, and different areas, studying abroad. However, for the most part, I know this is directed at more along the lines of my health and how healthcare has affected me over my life. Um, for the most part, I've been fortunately very healthy. Haven't had to really frequent the hospital or even the doctor's offices for anything other than a checkup, a wellness checkup. Over the last 20 years, I'm probably somewhat stereotypical in that I frequent the doctor's offices infrequent because I'm not one that's been sick. So, but I do try to, here of late, I have been trying to be a little bit more consistent in getting my doctor's appointments scheduled on a yearly basis. Now, prior to the last few years, I think I may have visited the doctors maybe every 5 or 6 years at best, um, just because I didn't think there was a need. But as I get older, I'm finding that it's more needed now, and it should have been needed then, just to be preventive and have a baseline of what could be thereabouts. So for the most part, I've had good good health and limited the need of having to worry about healthcare issues.
Thank you for that information. And, I'm happy that you hadn't had to frequent the doctor that often. But of late that you have gone, you said for preventive experiences, and and again, even if you had to take your parents or other people like that to the doctor, you can relay on that experience as well. But it's not unusual that, unfortunately, it's not unusual that men, the African American and people of color, tend to avoid doctors and tend to avoid doctors' offices. And so that practice is not particularly unusual. And so we'll go into that a little bit. So when you have gone into the doctor, either for your own personal need or that of other people, do you feel, just off of the, just off the top, off the cuff, or even if you go into places like urgent care, if you have to take any of your kids into the hospital, the emergency room, or the urgent care, or those kinds of, any kind of encounter, or down the street clinic, or any kind of encounters that you've had within the healthcare arena as well, is what I'm asking you to reference. So have you felt comfortable in these environments?
Well, in me saying that I've started going more frequently, a lot of it has to do with my parents, my aging parents, where I've had to witness doctor's care with them. And I gotta say, in some situations, it was positive, but in a lot of situations, it concerned me that they weren't getting the quality of care that I felt that they were deserving. And thus is the reason why I think I'm more apt to go to get my checkups now, so I can have a relationship with my doctors to hopefully avoid maybe some of the pitfalls that people that may not frequent a doctor's office, and they're just a number that comes through the system and they get them in and get them out. I'd hope to have a relationship with the doctor where I can maybe alleviate some of those issues. But in regards to my parents, I have a diabetic dad who has had in several cases not received the quality of care that he felt was on par, and I've witnessed. So it's not where it was just from one perspective. I was able to see, where I had to intervene to kind of get things back in line.
Tell me a little bit about that. So, so tell me a little bit about, just a little bit detail about maybe what your father may have voiced to you as his concern. Was it an issue of trust, or was it an issue? What do you think is issue, and your issue too? Well, what were those issues?
Well,
you know, you didn't think, and he didn't think he was getting quality care for his diabetes. Any ideas as to why, maybe?
I would say, depending on the doctor, because we've gone through several doctors, he felt as though it was more of a monetary thing than providing the quality of care. However, it shouldn't be at the expense of a patient when they are needing quality advice to be able to deal with whatever ailments that they're dealing with at that time. And, you know, they're already, patients as a whole are already dealing with the uncertainty, the unknown. And then to compound that with someone who don't value them or may appear, I shouldn't say they don't, I should say appear to not value them as someone that needs their advice, because they're the professionals. And in any industry, you consult professionals to give you advice in areas that you don't have. But when that is lacking, it kind of leaves you at a discomfort, especially when you're getting information that you're supposed to utilize. You kind of question, is this information accurate and is going to be beneficial? So with my dad in particular, you know, like I said before, we've gone through several doctors, and sometimes it's personality conflicts. You know, everybody's not going to get along with everybody. But the information that's being provided should be consistent. If doctors are supposedly studying the same way and not looking out for self-gain, but looking out the well-being for the patient. So from that perspective, I feel like my parents, and he's expressed to me in the past that he just didn't feel that his interest was at the forefront of the doctor's expertise. Now, from my perspective of things that I've seen is, you know, I can just recall a couple different doctors where now the doctor could have woken up on the wrong side of the bed. No. With me being in the industry where you have to give people the benefit of the doubt, because what you see may not be what it actually is. So I try to look at it from that perspective, where, you know, just because someone may say something off the cuff that may not align with what I think it should be, I know that I'm a forgiving enough person to step back enough to let the person recorrect and get things back in line. But when that doesn't happen, that's where I have an issue. And because we're all people, we all have to respect each other. And, you know, no matter how much education you have, when a person is being consulted for advice in a particular area that they're unknowing of, they expect to get that, especially when they're being compensated for that information. So,
I'm sorry, go ahead.
So, you know, for the most part, the doctors that my dad has had in the past.
So I'm curious, thank you for that. I'm curious, you mentioned a couple of things that I'm going to piggyback on. You mentioned that your father didn't feel valued in the relationship with his doctor. I don't know if he explained that to you at all, what value means in this particular arena, a healthcare arena. So when you say value, is it that you're saying, or maybe he's saying, that he is not feeling like he's being seen for him as an individual and his particular issue? Is that what, or what exactly do you think he means
Well,
by
well,
value?
okay. So I can only give examples.
Yeah. Right.
So I can't think of anything right off the top of my head of where he's. Well, I can say just a couple of days ago, he called in to see if he, with COVID, we're in the climate of COVID. He's in that age group where he should be able
Right.
to possibly get the vaccination. He
Right.
reached out to his primary care doctor, asking, "Hey, look, at what point can I find myself being able to get the vaccination?"
Mhm.
And his doctor response didn't address his request. He gave a very generic, non-addressing um, statement that he has to wait his turn because there's an order in which the vaccinations are being administered.
Yeah.
Now, granted, that may be okay. The first comment was, "Let me give you the breakdown of how this vaccination is going to be administered,"
Yeah.
which from a patient perspective, when he already knows that he is in a higher category, a higher risk category,
Yes. Hmm.
the statement that the doctor wanted to forward or has forwarded wasn't uh, conducive to him getting the answer that or the reply that he should have gotten.
Yes. Yes. Yes.
So that's, I guess, a small snippet of how sometimes people or doctors, since we're talking about healthcare, um, may lose focus or lose sight on how the patient could feel based on the reply that they give them.
Yeah.
And everybody is not made out for a cookie cutter response.
Yeah.
Not that every doctor is going to know every patient on a
Right.
first name basis,
Yeah.
but when a doctor is supposed to be providing a level of care, it would be, especially from a patient who he has a high he's at a high risk.
Hmm.
It makes him feel better that if someone that he's going to give him that reassurance that he's going to be okay
Hmm.
is given what he's expecting.
Right. So your dad, I mean, I agree with you. So your dad obviously is, as you say, in that age group. So he grew up in different times than we are currently.
Sure, sure.
And so obviously he has weathered different experiences, and so he has memory possibly of experiences and things that happened in his youth or younger years. How much do you think that impacts him? Have you ever had that discussion? And even you in your experiences, I mean, the history is not too long ago. So,
Right,
um,
right.
I mean, how much do you feel, or in the conversation with him, feel that experiences of past impact your negative experiences of past, impact the way you see or he sees another doctor, maybe a doctor of a different race, of a different color, of a different culture. How much do you think that impacts what's happening today from perspective of your and his health, your or his health? I mean, in other words, how much of that is carryover? And I guess where I'm going with this is some of the things that you've mentioned. How much of that does he think has anything to do with the color of his skin and who he is and what he looks like?
Being a black man and dealing with doctors, both white and black, actually across the board. It's I don't think it has to deal with race per se, but I can say it may be from the background of the doctor, because if a doctor and any person, I think, can relate to the majority. And I don't know, I can't even go there. Granted, with his comorbidities, being diabetic, he's going to see the doctors a lot more. So he's going to have a lot more um, invested, so to speak, than someone who doesn't go to the doctor but once every year. And he is looking, or his perception is going to be raised or more engaged than, say, mine, where I'm just going in knowing that it's nothing going on, or at least assuming nothing is going on. If his outside influences are a spin from his upbringing, if he's thinking that maybe that's part of why he's being treated that way.
Yeah. Well, so a lot has to do with how you're actually being treated and what your perception is of how you're being treated, right? So a lot of it has to do with perception on both sides of the quote table, so to speak. Okay.
Yeah.
You may be perceiving things in a different reality from a different filter than the person on the other end of the patient's table may be seeing things from the same thing from a completely different perspective. So, like I said, we're things like screening, women mammograms, pap smears, men prostates, and so on. I mean, when you go to the doctor's office, I know nowadays we've got lots of different formats and EMRs, so hopefully these questions become commonplace. But do you feel that you are, even as you don't go to the doctor every day, do you feel that you're said, okay, Mr. McNeil, you're X amount of age old, and you should be getting this and that, and you should do this, and this should be done, and so on and so forth. Are you getting that kind of follow-up, or that kind of urging or encouraging or suggestion, recommendations?
Fortunately, I am getting that type of advice, because I'm relying on the expert who has gathered the information to give me guidance of how I need to proceed with the forward.
So they have mentioned this. You have had folks say, okay, you're this age group, you need to be doing this now. And you
Correct.
need to be getting these things.
Absolutely. And also with the background, dad being diabetic, and even beyond, my grandparents, they've had existing conditions as well. When they gather all this information, they kind of give me some idea of what I need to be looking for, so that I can get ahead of the curve. Which, there again, I go to doctors for their professional opinion based on the facts they have. So, that's what I rely on for the doctors.
You would hope, as you said, I think earlier, for the most part, the doctors are being taught same or similar things. So hopefully that sort of thing is standardized. For the most part, let's just say that sort of educational expectation is standard. But so what changes outside of that standard education is going to be the doctor's demeanor, the doctor's habits, the doctor's perception. So that kind of personal influence that you kind of bring to that professional knowledge, so to speak. Okay. You go for the professional knowledge, but you may come away from that with the professional knowledge, but not necessarily with the warm and fuzzies sometimes. And that doesn't have to do as much with the knowledge as it does have to do with just how you felt, how comfortable you felt.
Right.
So, unfortunately, we live in an era now where, if, for example, with pain medications and things like that, we have a population that is high sickle cell. And so a lot of times and even with outside of sickle cell, but just with other, any diseases that require pain medications, It's been known that people of color tend to not get equivalent dosages of pain medicines oftentimes because there has been this erroneous, wrong perception that the people of African American, people of color descent have a higher pain threshold. That's not true, but that has been the perception, and so oftentimes people of color don't oftentimes get adequate pain control because of this erroneous perception. Likewise, women in mammograms tend to have very delayed recommendations. Women in cardiovascular disease, heart disease, tend to not be treated as efficiently and as expeditiously, as quickly as their counterparts in the non-Hispanic white race. So obviously these things impact our outcomes, men and prostate cancer. Have you felt that, again, either you or family members, have you felt that coming from certain socioeconomic background, not necessarily where you are now, but maybe where your parents or grandparents or where everybody grew up, do you think there's an impact there? I mean, living in one neighborhood versus another neighborhood, access to doctors, access to enough doctors, access to health care. How much do you, in your experience with your either parents, grandparents, or any other family members, sister, brother, cousin, or whomever, do you see that has there been any kind of impact with regards to just their circumstances, where they are, because here's the reason why I'm asking that, because we know, and we say often that healthcare is local. So, and healthcare is not so much about genetic code, but about your zip code. Okay. So a lot of times the outcomes that you have a lot to do with where you are and where you live and where you're coming from. Then it has to do with your disease. One person can have diabetes, the next person can have diabetes, and live in completely different areas, completely different neighborhoods, completely different access to physicians, different lifestyles, and have completely different outcomes. One not so good and one much better. So, so do you feel, have you personally or from extended family, do you feel there's been any impact with some of the factors that I mentioned, socioeconomic, lifestyle, social, where, education, economic opportunities, ethnic, racial, neighborhoods. Some neighborhoods don't have a lot of parks, so there's not you don't get to go out and walk and run and do all these things as other neighborhoods have parks and fountains and all these nice things. Access to preventive care, like I mentioned, vaccinations, cancer screening, things like that. Do you, in growing up, or your family growing up, or any experience or any exposure, church, people that do you see that this has an impact?
I think a lot of it, there's a social impact, yes. Mm-hmm. I think or believe a lot of it has to do, maybe not so much of the zip code that you live in, but your educational background. Because if you have education, you possess a skill set that you are able to call things out because you have the information to know how to call things out.
When you say call things out, you mean things that really aren't going quite right, and from your perception are unequally treated.
Exactly. And then at that point, you can seek out those resources that you are able to get the quality of help. But if you're not in the area or if you don't have the educational background that can help you minimize the risk factors versus someone who doesn't have that educational understanding, they're going to typically take whatever someone says at face value and run with it, which will allow them to find themselves more on the experimental side versus the knowing side.
Do you So you're right. And so some of these things negatively impact, whether it be diabetes or heart disease or cancer or whatever whatever the ailment is that someone may have or may have predisposition to get. Um, have you seen in your wherever at all where, geez, if Aunt Sue had just been able to, go see the doctor more regularly, or you know, if Betsy at church had, or if, these if questions, okay? So, if so-and-so had, or if you're talking to a group of guys, guys like to get on talk. You're talking to a group of men and, like, hey, have you had your prostate checked? Did you do this? Have you done this? And there's a lot of discussion that goes on in those environments, real talk that goes on in those kinds of environments that is not shared with doctors. And then so never the two shall meet sometimes in some circumstances. So, I mean, again, if you're in company of other men, your age, a little older, a little younger, and having any conversations, healthcare related types of conversations, have you ever noticed or experienced that, man, you need to go get that checked. Why don't you go get that checked? You need to go do that. Why don't you go do that? What have you experienced in that population of people, men? What's been your experience?
Well, us guys, we've actually this past week had someone who had been absent from going to his doctors, and he had an episode at work, and he realized that he had not been going to the doctor, so he's taken upon himself to make it give a valid effort to try to make sure he gets to the doctor. And he's just one that didn't feel the need to go. He was fine. He had just worked through whatever the issue is.
So in other populations, oftentimes it's ingrained. Now, we know men tend to be a little more resistant than women, and the women have to kick the man out the house to go to the doctor. So we know generally men, no matter what race you are, that's an issue. But having said that, though, a lot of times the men in the African American / people of color, or what you call BIPOC, BIPOC groups, they just don't get that knowledge shared with them that, man, look, 35 years old, 40, 45 years old, these are the things you need to be doing, okay, even though you feel good. And so this is possibly some of the statistics that I mentioned, why we have such bad disease problems, because we don't take care of it younger, because we're not. So
which goes back to what I was saying. It's the educational levels, because I typically have that conversation with guys that have been educated, that understand the importance of going to the doctor. They're more inclined to go, versus those that I've dealt with that don't understand how things are supposed to go. They typically are less likely to go to a doctor's office or get checked out, or do those things that could be preventive versus reactive.
But don't you think some that are educated, education is a big part. I agree with you 100% there too. From a socioeconomic standpoint, employment, income, education, all of that has to do, in that socioeconomic standpoint. But there are even some who are quite educated and quite, comfortably from an income status standpoint, and just have other reasons. We're seeing this a lot with vaccination. Across the board, not necessarily having to do with education. And so we're seeing where, I'm not going to get that vaccine. I don't trust folks. Have you heard that?
Well, I've had that conversation too about this vaccination, and the history of the U.S.
So this is where I'm interested in hearing about that, and what it is about that is impacting you and other people that you may talk to or socialize with to move ahead with the vaccine. and I don't want, I'm not pushing the vaccine, so that's not the purpose of this conversation, but the point is that's one, and there are other things similarly, which goes back to the issue of trust of the health department. So I'm curious to hear what your conversations are.
Okay, well, you know, in speaking to vaccinations or um, just the whole guinea pig concept, we'll try it on them to see how it affects them before we allow anyone else to try it. It's been part of history since the beginning, or historic stories that have been perpetuated throughout the history of 400 years. And you know, when you talk about this Tuskegee, the Tuskegee, yes, the syphilis campaign, and then you think it's hard to place your faith in areas where, you know, they say, you know, um, place your faith in areas where you've been bit several times. It's like, okay, do you really want to subject yourself to that again?
Does that affect your thought process? When you go to the doctor?
Since I've been with my current doctor, I've been more inclined to go more frequently. Maybe that probably had something to do with me not going in my earlier years. It was like, you know, I don't want to be a test dummy. However, recognizing that I've had to go to many doctor's appointments with my parents, and watching him go through the aging process, I know that there are things that I need to be aware of.
Yeah.
Which goes back to the educational part. We as a people, I don't think, know our history. Thus, we don't know how to go about preventing things that should be preventable. And part of that is
important.
Yeah, part of that is because we're disconnected, or people are not passing on information.
Let me understand what I want to touch on that don't know the history and then disconnected. Don't know the so help me with that. Don't know the history. What history are we talking about?
I'm talking about their family history, the medical history. So, but I don't think that kind of information is passed on. Things that are important aren't important anymore.
Like talking about your family history, you need to know what your family history is. You don't know your history, and so you have this distrust, and you have this feeling of a guinea pig, and you know. So
I think the other thing is monetary. You know, where we as a people are worried about keeping our lights on, where others, they have access to what they need, and you know, if they don't necessarily have to pay for that service because they know the doctor, or the family knows the doctor who can provide them the care and give them the expertise that they need, versus in our community, we don't have that resource. Even if someone wanted to give it away as free information, we wouldn't know how to access it because we don't have those people in our communities to give us that information.
You know, maybe healthcare educators, that kind of thing, or people like who?
Well, educators, I'm even saying the doctors.
If you had to, if you were part of medical school and you had to teach doctors, you were required to teach doctors, what would you teach them? What do you think, knowing your, you know, where your family background, your community, your friends, your buddies you talk to, you know, even coworkers, whomever you are in your circle, you know, experiences that you've had or they've had, or you've talked about, church, what have you. You know, what do doctors need to know? And how knowing these things can help make the environment more accommodating for people of color, again, the BIPOC, to access. What needs to happen? What needs to change, in your opinion? You're the teacher, and you need to tell these docs what they need to know and what they need to change?
You know, I feel that doctors they need to put themselves in the patient's shoes. If they were on the receiving end of the information that they are providing, would they really want to hear it the way they're delivering it?
Right.
Uh,
So you're saying, I'm
because
going
the
to interrupt
delivery,
you a couple of times. So you're saying then, so, you know, you doctor need to understand my experiences as an African-American male. I mean, again, male and female different. So African-American male, okay?
sure,
You need to know where I'm coming from, and you need to understand what I have been through, maybe not personally, but me as a race has been through over these years, and what my perception is of you. Is that what you're saying?
exactly.
By into my shoes? Because certainly it's going to take the doctor stepping outside his and herself to appreciate your experience. So it's going to take some concerted effort of the doctor to say, okay, you know what, I need to understand a little bit about Mr. McNeil, where he's coming from, and what kind of story he brings to the table. That's necessary?
Absolutely. And if the doctor takes that effort, in my opinion, to try to identify with all the baggage that I'm bringing into his office, consulting him for advice to make me better, he would deliver it in a way where he can empathize where I'm coming from and why I'm probably not as anxious to go to his doctor's office, to hopefully encourage me to come back more frequently.
Yes.
To possibly minimize or eliminate things that I could possibly avoid.
Right.
But if they continue as status quo and treat me as just a number, it only lends itself to continue.
So if the doctor was able to understand a little bit better about you and your circumstances and where you came from, you know, and what you said, use the word baggage, what baggage you're bringing into his office, but the, you know, your feelings from a cultural aspect. So that's some of the stuff that you feel that he or she should know.
Absolutely.
You know, and one of the things too from a culture, just to say, one of the things too from a culture is, you know, we're trying to change this in our industry currently, but you know, things like diets, for example, you talk about diabetes, you know, but also things like high blood pressure and other things like that, dietary habits, African American, Hispanics, everybody has some different type of dietary habits, but on that diet may not have anything to do with what your culture and what you eat on a regular basis. Okay, so
right.
That kind of appreciation and understanding as well might help.
Right, absolutely. But there again, you may not have the economic means to meet that diet that the doctor is providing.
Okay, very important. Yes.
So
yes.
You may understand it's better for you, but if you don't have the means to go get those fresh vegetables and fruits, because you're looking for something that's going to be a quick fix, then the diet is meaningless.
Okay, so you know, we're going to close here in a little bit, but I like that point, and I just want to ask you, I just want to go a little bit on that here for a minute, okay? So, but that too, he or she would need to know. So no, this just has to do with economics, what you just said, okay? So in a sense where someone may not be able to afford the medication, and they come into the office and they're not taking the medication, and the doctor chastises them about not being compliant. And the reality is, you know, if the doctor was able to understand your circumstances and maybe where you are, where you live socially, and the difficulties that you have to go through to even get to the doctor's office, might be beneficial.
Right. But how do you provide that in my opinion, which I don't know. That's not typically something that's asked on a application or information gathering.
Right.
So how at what point does the doctor intervene and say, hey, look, kind of give me some insight without prying too much? Because then that could be like, hey, you're prying into my personal space. And now you have the patient saying that you know, I don't want to give you that information because that's none of your business. But the doctor is saying, I need this information so I can guide you on how to manage what you got.
Well,
so
you hit the nail on the head, because unfortunately, a lot of times in the African American male population, they are not willing to share information for a lot of reasons, personal information, okay? And so you get into this impasse. But you had a great point, because your point is really the doctor needs to be able to learn how to bridge that gap.
Correct. It's like a relationship, which it goes back to what the reason my initial thoughts were as far as me developing a relationship with my doctors now, because I know I'm getting older. I know I'm going to need some type of assistance down the road. To what extent, I don't know, but I don't want to meet some doctor that's going to treat me as a number, that's going to push me in and bring me in and push me out and just say I got a tick for the day, versus someone that's going to have a relationship with me over 10, 15, 20 years. And say, okay, I've watched you progress. Here's where we're at.
Yes.
Let's figure this out together.
Right. I mean, you've listed a lot of important things. You've listed, from a social, from an economic standpoint, from an access standpoint, from an understanding standpoint. You've mentioned, financial. So you've mentioned a lot of these things, and you mentioned also not wanting to share information. Very common in the African American male population. From a lot of socioeconomic reasons growing up. So that is very important and very key. So you've hit on a lot of stuff, and I want to thank you, and I want to appreciate it.
Thank you.
And so again, this is Dr. Shaw with Shaw Medical Travel Consultants, and this is Mr. Walter McNeil Jr., who has enlightened us and shared with us quite a bit of information as it relates to the African American male perspective. Like our video, and also to subscribe to our YouTube channel. We have a lot more videos that are coming for our audiences on a different cultural backgrounds. And so, Mr. McNeil, thank you.
Hey, thank you again, doctor, and look forward to the video.
All righty, thank you.
Have a great
Bye-bye.
day. Thank you. Bye-bye.